Yippee woo, everyone, and thank you for joining me today. My name is Serio, and I'm a member of the Chicor and Chakri tribe of South Carolina. I've been working in the tech space since around 2010-2012, beginning as a front-end developer and later transitioning to product and UI/UX design. I'm a co-founder of ShockTalk alongside Sutton King. ShockTalk is supported by the Urban Indigenous Collective Team, a passionate group of Native professionals dedicated to the health and well-being of Indigenous peoples. I'm excited to share with you today's ShockTalk. ShockTalk seeks to decrease adverse mental health effects in Native American and Alaska Natives by connecting users to Native therapists trained and experienced in cultural humility through a telebehavioral and well-being app focused on healing unresolved historical and intergenerational trauma. We're designing ShockTalk specifically for our communities, built with crisis response in mind, facilitated by a culturally appropriate matching algorithm, and backed by robust Medicaid support. ShockTalk promises to be the first culturally tailored healthcare solution available outside of the colonial dynamic, accessible regardless of recognition status or geographical location. Why is ShockTalk important? ShockTalk is for self-identifying Natives seeking comprehensive mental health support. Due to colonial policies, 71% of Native Americans and Alaska Natives today live in urban areas, yet this geography is not reflected in the Indian Health Service funding structure. IHS is funded at only 52% its total capacity and dedicates only 1 to 2% of its line budget to urban Indian health programs. As a result, the 20-year suicide rate for Natives stands at 139% for men and 77% for women, respectively. The federal government intentionally creates and perpetuates the problem. It cannot be entrusted to fix it. Our revenue model focuses on Medicaid reimbursement rates. ShockTalk seeks to create good-paying clinician jobs in Indigenous communities while lifting the financial burden from the underserved and economically disadvantaged user. We plan to use a third-party insurance billing partner to process the insurance payments from over 4.9 million potential users. We've been working every day for the past 6 months in preparation for our current stage of incorporation and concierge coding. With the second wave of COVID-19 and a high-stakes election on the horizon, we know we have no time to lose. Having the support of the MIT Indigenous Communities Fellowship and access to its resources will allow Team ShockTalk to complete our concierge, our final step before making impact in our community. Together, we will break down the colonial barriers to healthcare.